It might be confusing, but normal periods is something that varies from person to person. And even more, even one female might have slightly different menstrual cycle from month to month. How could you know what's normal and how could you know when to seek for medical help? Hi, I am Dr. Olga, OB-GYN. I'm happy to welcome you on my YouTube channel, and today I want to discuss normal periods. It's true, every person's periods is unique, and what's normal for one person might be not normal for another. And there are so many misconceptions, and there are so many anxieties that surrounding periods. Like, you might be worried that you have irregular periods, or you might be worried that you have a heavy bleeding, but it turned out that it's actually normal and you have nothing to worry about. So to know what is normal periods, what is normal menstrual cycle, might be very, very liberating. And of course, you need to know what is normal, because when you know what is normal, of course, you know what's not normal. And so you would know when to seek for medical help. And there's so many misconceptions and anxieties surrounding periods, so I decided that we need to talk about it. One of the biggest misconceptions is that your menstrual cycle should be 28 days long. Well, actually, the normal menstrual cycle is between 21 and 35 days. And as you can see, 28 is just an average number. And actually, the normal length of your menstrual cycle is something that depends on when you first had your periods, like when you had your first periods in life. First of all, we should remember that having irregular cycles is normal in the first year post-menarche. Menarche is the first menstruation in girl's life. Okay, if you're more than 1 year and less than 3 years post-menarche, it's okay for you to have cycles between 21 and 45 days. If you are more than 3 years post-menarche and to perimenopause, irregular cycles is when your cycle is less than 21 or longer than 35 days, or you have less than 8 cycles per year. For those who more than 1 year post-menarche, irregular is when they have longer than 90 days for any one cycle. Well, I have noticed that many females don't know how to count the length of menstrual cycle, so let's talk a little bit about it. You should count the length of menstrual cycle between first day of your previous menstrual cycle and first day of your next menstrual cycle. And first day of menstrual cycle is the first day of full flow. The next very common misconception is that you should have your periods at the same time every month. Let me explain what I mean. For example, you have your periods every 27 days, but this time you have your periods at the 29th day, and you think that something's wrong, that you have a regular menstrual cycle, but actually it's absolutely okay. The length of your menstrual cycle might vary a little from month to month. Like, your cycle might be 2 or 3 days earlier or later, and it's absolutely okay. What is the normal length of menstruation? How many days should you bleed? Well, the normal length is between 2 and 7 days. But again, the length of your periods might vary a little from month to month. Like, 1 month you might have 3 days periods, and the next month you might bleed for 4 days. And again, it's also normal. But you should pay attention on your menstruation if it lasts longer than 7 days, because it may be a sign of some pathology, for example, endometrial pathology, adenomyosis, or myoma. And also, you should pay attention if your menstruation is less than 2 days, because it's also, again, it may be a sign of pathology. And especially, you should seek for medical care, for medical help, if you used to have your periods lasting longer, but after you're giving birth, or after an abortion, or maybe after some intrauterine surgeries, your periods become shorter, lasting for 1 day. You should go and see, you should really ask your doctor about it, because it might be a sign of Asherman syndrome. Heavy periods is bleeding lasting more than 7 days, or loss of more than 80 milliliters of blood per cycle. It might be a problem to measure your blood loss, but it's not really necessary, because there are signs that can help you to understand that you're bleeding heavy. And these signs are: need to change your pad or tampon every 1 to 2 hours, or empty your menstrual cup more often than is recommended. Need to use 2 types of sanitary products together. For example, you need to use a pad and a tampon at the same time. Having periods lasting more than 7 days. Blood clots larger than quarter. Bleed through your clothes. Avoid daily activities like exercise, or take time off work because you have periods. Feel tired or short of breath or dizzy a lot. Need to get up during the night to change a sanitary product. If you have heavy menstrual bleeding, you should make a doctor's appointment. Doctor will do a pelvic exam, pap test to check your cervix, ultrasound. Your blood may be tested for iron deficiency anemia, for hormonal disorders or blood clotting problems. Doctor will also decide if endometrial biopsy, sonohysterography, hysteroscopy and other methods are needed. On my YouTube channel, I have a full video about dysmenorrhea, which is a medical term for painful periods. And in this video, I'm talking about what type of dysmenorrhea there are, what can cause you to experience a painful periods, and what you can do about it. So please check it out. Remember that periods, it's a part of female physiology, and it shouldn't interfere with your daily activity. If you have to change your plans because of menstruation, because your menstruation is too heavy, or because your menstruation is too painful, it's absolutely a sign that your periods are not normal and you need to go and see a doctor. Thanks a lot for watching this video. I can't wait to see you soon in my next one. Bye!